We'll start off here. One thing that we keep revisiting all the time within our staff, and it kind of may apply to other areas of sports, would be like positioning and where to stand, where to do different things in order to provide feedback. So when I was in grad school at West Virginia, you started using in the sports science coaching program, they started using something called the West Virginia University Teacher Evaluation System. So they stole it from the way they scored PE teachers in regard to like a research setting, and then they started scoring coaches, like
how they present, what do you mean? Like when they're teaching?
during practice.
Oh, okay.
So for example, like I was part of a crew that we went to basketball practice, and like Bob Huggins, and you like watched what Bob Huggins did, and you like just sat there and tallied what he did. He did this, he said this, he was
You
involved in
evaluated
this.
him.
You basically
Like
evaluate.
body language, stuff like that.
Not necessarily body language, but his level of instruction and feedback.
Okay.
And basically this system was created by a guy named Dr. Andrew Hawkins. He was a professor of phys ed in West Virginia, an older guy. And it started with just PE teachers. And it started in their PE program and how is the best way to be a great PE teacher. And it's certainly not rolling out the walls. And there was a lot of similarities between physical education and coaching, obviously. So we started bringing this system into coaching and seeing how we could do different things with that. So basically, you have a coach or a teacher, and he or she's providing instruction on the field, and it may be related to performance, it may be related to getting ready to do a drill, something of that nature. And then at the end of the lesson, at the end of practice, they get scaled. Okay, you spent this much amount of time providing specific feedback, this amount of time in straight modeling, this amount of time hands-on with one athlete. And obviously, depending on the sport, the activity, whatever that you're trying to do, it's going to depend on how much you should have in each one. So basically, these are the teacher/coach behaviors that they identify. And all of them are very different. On the flip side of this, there's student behaviors or athlete behaviors. And we want to make sure that they're in appropriate levels of behavior. Okay, so the first one, general observation. So general observation would be where a coach or a professional is in a situation where I'm looking at the room and I'm just making sure everything is safe. Okay, so from here, I cannot be actively engaged in one single athlete. I am just making sure the room is good. The bars are traveling free from hitting people. The music is appropriate so people can voice a concern if that was the case. There's no trouble going on. The issue with general observation as a coach is if I'm just standing back and I'm making sure everything is good, there's no way to provide feedback. I'm not coaching essentially, I'm just monitoring. Now the thing with this is if you have a 1:60 ratio of coach to athlete ratio, you're going to spend a lot more time in this than anything because you have to. That's why 1:10, 1:20 may be a little bit more appropriate. So this is basically just what it says, general observation. If I have a weight room or a field, I may be in a corner so I can see all racks. I may be down the middle so I can see all racks. If I'm on a field, I may be in a corner or to the side. Essentially just making sure everything is good. Now that's going to change too, depending on what I'm trying to coach. So if I'm actively instructing a drill or I'm actively running a session, it may not be great for me to be in general observation because I need to provide feedback. But at the same time, let's say I'm support staff, let's say I'm a strength coach and I'm on the sideline or in the dugout in a game, I need to be more general observation because I'm not necessarily the point person at that time. So there's different times for it. Okay? The next coach behavior would be called encouragement. That is essentially feedback, but it's not feedback to change anything. It's just like, hey, here we go. It may change the tempo. It may change something real quick. Hey, let's go over here. Or let's on a hop, intent, move with intent, just little buzzwords like that. But again, it's not necessarily showing or providing feedback that's going to directly change anything. Positive feedback would be anything that's coming from the coach that reinforces something to continue the thing to happen. So it's like if I'm a coach and I'm talking about squat and my cues for squat are like knees out, butt back, chest tall, and I see that, I'd be like, hey, great job keeping your chest up. Great job keeping your chest up. Great, knees out, knees out. That's encouraging. That's being very positive to reinforce those continued behaviors. The flip side of that is corrective feedback. Corrective feedback is something that's going to really stop that behavior. So, hey, we got to make sure we stop moving when the bars are traveling, or we cannot go in between the racks. You need to change the direction that you're doing your band pull aparts. You're stopping a behavior from happening. Now with these two feedbacks here, and I'm going to get to a specific observation here in a second. Positive feedback, as a coach, I can be basically anywhere in the room. Hey, let's go, great job, chest up, great job, chest up. But corrective feedback, I need to be in more proximity to the athlete. I can't yell at rack 7 if I'm standing at rack 1 and cause a change in that behavior. I may cause it to continue, but I can't necessarily cause it to stop. Okay, management behavior. Management behavior would be anything like taking attendance, taking roll, taking body weights, but it's not necessarily like teaching, instructing, or causing a change in behavior. It's just basically management. Verbal instruction. Verbal instruction, and hey, guys, this is what we're going to do here, 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 here. Ladies, we're going to start out on the field, then we're going to transition into the weight room, and we're going to do this, this, and this, and this. This is how I do this athletic skill. When I clean, I want knuckles down, I want to lock in, I want to get tall. That's verbal instruction, but we're not necessarily engaged in much of anything. It's just providing instruction. Okay, modeling. Modeling is a behavior where the coach is actually showing. Okay, so if I was going to get in a 2-point stance here, this would be modeling. If I was going to show our athletes how to do a squat, and I was physically in the rack, that becomes modeling. I'm showing the athletes one thing. The bad thing about doing a lot of modeling is the athletes are not doing it. Good, yes, maybe early in the semester, but we got to be careful how much we model and do that because it's taking away practice opportunity. The next one would be physical guidance. Very, very similar to modeling, except that is hands-on an athlete. So if I was coaching Thomas, I would be letting you do the drill, and I put my hands on you where I'm close enough to you to say something so that you can change your behavior. So these are very, very similar. One may allow the athlete to fail and get better a little bit more than the other. But both at different times of the year are going to be appropriate. Okay? Non-task verbal, that would be like if a coach is just kind of hanging out. So let's say in this weight room, as I'm here, we're training maybe, and I just find myself on this rack over here, and I'm talking about the weather with one of these guys, or I'm talking about some music with one of these guys. It's not necessarily specific to what we're doing. It's labeled non-task, so kind of basically not even associated, but I am engaged. Although not necessarily appropriate for making us better in this situation, it's important because we have to have a relationship with the athletes. So fine, just got to keep that time spent in that little area a little bit lower. Off task is just as it says. Off task is like, I am not paying attention, I'm not doing anything, I'm just checked out. We want to stay away from that at all costs. Then, specific observation. I don't know why I should have set it up here, but specific observation is much different than general observation. Where general observation, I'm essentially like trouble checking, making sure everything is safe in the room. Specific observation is I am watching with intent, with the sole purpose of providing feedback to improve performance. So if I was working with Corey and he's doing a drill on the field, in the weight room, in rehab, I am watching you, I'm close to you. That is a key thing too. I have to be very proximal to the person I'm talking to and watching, so I can, one, see errors occurring, and two, provide feedback that's going to automatically cause some change over time with reinforcement. So specific observation is getting close. So if I'm working with Corey, I'm going to be really close. I'm going to be talking with him. I have enough space here that he can do the movement, but I can see errors. And then I can talk to him and he can hear me clearly. If I'm trying to provide specific observation to Coach Stacy over there, I'm not close enough for her to feel comfortable with that feedback. So general observation, more wide, specific, more narrow. All of these are going to occur when we're coaching or working with athletic skills. they're all going to occur. What we want to do at different times of the semester is have basically different percentages of our time spent in each one of these buckets. Early in the semester, where we're teaching, instructing, doing certain things, we may spend a little bit more time in modeling, physical guidance, general observation. Then when we teach a new skill, it may flip to specific observation. But over time, we want to spend different amounts of time in each one of these, and that's going to allow us to do a lot of things. Now, did not put anything up here, but there are athlete behaviors as well. Very similar to this. Basically, we want our athletes spending as much time as they can in appropriate, developmentally appropriate opportunities that they're improving. So if I'm spending a ton of time in management, they may not be doing much. If I'm taking up the majority of my time talking, we talk about like lines, laps, and lectures that we want to avoid because our athletes are not really doing anything that's making them better. If I spend too much time here in physical guidance, or modeling of physical guidance, or just talking, they're not getting better. So as we organize our training, as we organize everything that we do, we want to make sure that we're maximizing the amount of time our athletes are spending in those appropriate situations. This hasn't been used a ton, to my understanding, in looking at coaches, but when we started playing around with this, it's really neat in assessing personally what we do. For example, last Thursday we had a baseball training session. It was me and 38 dudes. The majority of my time was spent in general observation, encouragement, and basically management. There wasn't a lot of coaching going on. At the beginning, I was talking, I was doing certain things, but the majority of my time, if I was to grade myself, was in those. After the fact, I'm looking back, I had to improve my specific observation and then corrective feedback. I had to do that. So we had a couple other people kind of be around so that they're then looking general observation and management. But we want to be able to coach. We want to be able to instruct and improve our performance. So in order to do that, we have to be a little bit more specific observation and then our corrective feedback. Any questions with that or discussion that we could maybe have, or maybe how it could apply to what's going on in maybe the rehab setting?
Well, I mean, Ryan's just coming off a great example of what they were doing during 2 days, where they had like 25 guys coming in at one time, zone coverage of one physical therapist, athletic trainer to watch 25 guys. So I mean, my guess is you're in general observation, or you can't.
You kind of, in this example, you kind of float between your different racks.
Yeah.
And then you do different things based on what guys are doing. So
Yeah.
some of it is corrective, some of it is general observation, some of it is specific.
Yeah.
So that was tough, but it is part of it. So.
Yeah.
But did they say anything about different types of cues to give, like tactile or verbal cues?
Absolutely, yeah. And when you're in the corrective feedback area and you are providing those cues, there can be some instruction, there can be some physical guidance, where you're doing a little bit of both. So here, hey, do this, do this, do this. And then if I touch you here on your knee, maybe that's pushing out a little bit more. Or hey, shift your hips over.
Yeah.
But there is a lot of both going on.
Or did they say which one's better? What do you think?
I think it depends on, one, the situation, the athlete that you're working on. It may be age, it may be training age, it may just be an overall experience.
Yeah.
But I do think the key thing when we were going through this was you can switch back and forth real quick. I can be in general observation and then see something, run over, and then now I'm here and I'm providing feedback. Then I step back and now I'm back here. So it's very free flowing. And I think what we always talk about all the time with our staff is basically just being very moving. And it's probably a little bit different in the medical setting. Yeah,
I mean, you know, even like I'm at A&T practice the other day, and I'm there to keep kids that are hurt safe, but I'm also listening to what they're being taught and the technique they're supposed to be doing it. And so my eyes are watching technique, but I didn't really feel like I was in a role to correct unless they were an injured kid. But if they were an injured kid and they were doing it wrong, I was questioning in my head, is that my place to go do that? Am I more in, you know, a secondary role here? But I mean, I think I'm personally doing that all the time. And I even, you know, like I struggle with, it's not one of my own athletes and I'm watching them do something out in the corner of my eye wrong. So I correct them, because they're not mine. I'm at a point in my career where I feel fine with that, but you definitely see the younger people as they come through, either A, they're not watching, or B, they see it, but they don't even know they're doing it wrong.
Yeah. Yeah, I mean, that could be a barrier for sure, especially as someone new, you go into a new setting, that's 100% change for you. You gotta feel comfortable before you can go into those different things, I would imagine. So how can we get more comfortable quicker?
And I would also, and I don't think it's the point of your talk, but talking about tactile touching, I think we also have to be really careful in saying, like, is it okay if I touch you? Like,
1000%.
I touch glutes all the time, and I'm
Yeah.
telling them, hey, you're in the wrong position. But I've been more conscious about, hey, is it okay if I, put my hand here? This is why I'm doing it.
And you talk about being appropriate. That goes with male versus female. That goes with age of athlete. If you're working with a youngster, there's probably no hands-on. Or if you're working with a big football guy that you've known for years, like, you can be a little bit more hands-on, where you're correcting maybe an RDL on his back or something like that. But yeah, great point for sure. In terms of like on the field, what's your thoughts?
I think it's a good thing, because especially coming back from on the road, it's, you see it, and the same thing, like, obviously football's going to start to play as well. You all have your roles and responsibilities, and I think that sometimes you do what the coach asks you to do. I think for me, like, with soccer, like, I know my role, like, I prime them enough where they'll do their own warm-up, but then, coming out, it's like, I'm on the end, the coach comes down, he asks me something, I'll say something, but it's very different compared to, it's the same thing with how he respects, like, in the weight room. Today, when they walk in the weight room, he won't say anything. If he has a question, he'll ask me off to the side. Same thing, so I think it's good to have that respect, because it is, you stay in that general observation, and at this point, it's like, no, I'm not going to give any feedback, but it's crazy when some of the girls were like, well, what do you think about the game? And it's like, well, you always go to it, it's like, oh, I've never played soccer before, but after observing for so long, it does help with other type of areas that you can go ahead and move forward with training or anything else, vice versa. So it's good. I had a coach when I first started, when I was at Michigan State. He made me, I hated it because I was always somebody, like, I wanted to run up to somebody and be like, hey, correct this. And he made me stand. We had an L-shaped weight room. He made me stand in this, like, he made a box out of athletic tape. And he said, we had 3 teams in there at the time. And he goes, you're going to stay in this box, and you're going to go ahead and verbally cue up somebody positive and negative. You can't leave your box. Hardest thing I've ever had to do, and I hated him for it.
Yeah.
I was like, you're such a mean person. I probably said something else, but I was like, at the same time, it did, because now, like, when you start having younger ones, if I said, hey, Chandler, like, go correct so-and-so, like, she's just going to run over there real quick, because they're a little bit more like, oh, I need to do that, but can you project your voice and catch the attention of everybody, because they might be making the same mistake.
Yeah.
So it's all kind of goes hand in hand.
Yeah. No, that's kind of a good question. I think as a professional, as we get a little bit older, maybe we shift what we're doing here. Maybe as a young coach, like what you're saying, it's much more moving around, hands-on, proximal talk, whereas an older coach, a more seasoned veteran or a professional can say it so eloquently that it just connects. So maybe there is some of that too. I think just for me being around this just a little bit, I always try to take inventory, not that extensive. I certainly don't grade myself and I don't film myself coaching, but I always just try to think of, was I in management the majority of the day? Was I providing feedback? Like, what did I teach? Did I improve anybody today, or did we just run around? And I think doing that has really helped me to, when it's game time, when we're in there on a training session or on the field, I am a little bit more active in providing some instruction that's going to improve.
Are you applying that to how you teach your younger staff or your interns?
We have, and the majority of the time that we talk about is not in this setting. We have gone over this a couple years ago, but what we always talk about is just essentially just being active, being moving, and it depends if you're in the weight room or in the field. But in the weight room, we want to try to see as many bars as we can so that we can zone in and provide feedback. If we're just like watching one rack, now if you have a bit large staff, it's completely different. But if you have, let's say, a training session going on in this little scenario there, we could potentially either stand what we typically will talk to our coaches about is standing in 45-degree angles. If I was coaching this side of the room, so I can see as many bars moving as I can. And then if I see some things, I can provide instruction, then back out. On the transition to the other side, I take this position, and then I get to that position. Now, when you have a large room that has a divide, it completely changes everything. Because if I'm on this side, I can't see that side, and you have to be moving around. On the field, we always talk about 45-degree angles too. In this position. For us, if we ever get here, you start to lose perception of what these guys in the back are doing. So I think just what we always tell everybody is just be moving, be talking, and just be watching all the time. It's a very simplified version of this, but that's what it all boils down to, at least for us.
For your corrective feedback, how much are you caring about the vocabulary you use? How much are you trying to say, like, instead of saying don't, give the correction? How much are you trying to use? I know this is like external cueing. Is that something you're thinking about or were you thinking about?
Trying to, it's super, super cliche, but with this, Dr. Hawkins talked about the sandwich method of feedback. Everybody know that? So, hey, freaking good job. It stunk. You need to do this, but good job
So
trying.
he agreed with the sandwich method?
He taught that.
There's stuff out there now not to get.
Yeah.
And the leadership things I've been talking
Really?
about, like when we oversaw students, it was to me
To
that's
stay
not the
away
kind
from
of
that?
feedback that they want.
Really?
Like, because
What was the reason?
that they're not really getting the message all the time.
You
like
mean it gets
especially-
lost?
Yeah.
One thing John Wooden was known for was if, say, Coach Nelly's doing a power plane and did one part of it wrong, tell him, Coach, make it look from here to here, make it look like this. You did this. Remember, here, we go, what it looks like, what you look like, what it looks like. What it needs to look like, what you look like, what you look like. So you started with, I suppose that helps you get from being too negative, but and then you're leaving a visual picture of what it's supposed to look like. That's the last thing you see, rather than going into this, and that's the last thing you see in front of you.
It kind of goes a little bit more tangible. It's got the talk and there's the feel of seeing.
I don't know what that's called from a psychology or teaching standpoint. I found myself gravitating towards trying to do that more. Like you said, using less, don't do this.
When you guys think about, you show something, sometimes it's a lot easier than saying it. We have such freak athletes and they're so gifted that even if you show something wrong, they can copy it like that. So I think that's one thing that we've had some success with is just having a good demo. And then that can apply right to them. Hey, you're doing this, check this out, do that. And then they can feel like that. Now, that may not be for all audiences. That may not be for like youngsters. That may not even be for the majority of athletes at this age. But at this Division I level, it seems like maybe some of the athletes are so high caliber that they can copy something that they see.
How do you handle that in a rehab setting in terms of feedback? Because that can be a really frustrating thing. I mean, I remember going through rehab times and it's like, okay, you know, I have to throw all over again. So now my PT, I mean, he just grilled me up. Talk about like correct. It was like no, like all that, whatever. But like, how do you handle it in that setting?
Well, I mean, you know, I try, like Kylie, for example, when you can tell she's just getting frustrated, then I might just forget giving anything that's not positive feedback, and she's had enough of it. And even though I think the feedback, if they're doing it wrong, is important, I also have like realized, no, they need a lot more positive. But as I said it too, I don't really want someone doing the exercise wrong. So if they're doing it wrong, but they're not getting it with the correctives, then I may stop it altogether and try something else to maybe break it down so that they can get to the right one and then show them how they're doing it the right way. Also, if I'm giving them something they have to go do somewhere else or with somebody else, may film them doing it the right way so then they have that either to practice on their own.
Sometimes you have to treat a kid and let other people watch him do it. I can't personally do it, you know, if it's like some crazy high level balancing, they might pick a kid that has great balance and like Harrison has ridiculous balance. But if you can show them how to do it and then they can watch him and
I'm thinking about what you're saying. I wasn't even gonna bring this up, but as you think about what the athletes are doing, like, is it motor appropriate? Is it like developmentally appropriate for what they're doing? Is it correct? At what point do we allow them to fail, then correct it? Or is it dangerous to let them fail? And I think that there's different activities, different movements that may be applied to all. If someone is squatting heavy, you don't want them to fail. We may correct that, but at the same time, if it's a little bit more submaximal, maybe you let them finish, then you provide feedback. It depends on the situation. Motor inappropriate would be just kind of like it's either too hard or too easy, then they're not improving. This would be like just spotting, cognitive. You know, if athletes are just listening, if we're in this setting here and we spent 30 minutes talking about the lift, talking about the practice that we're about to go into, and then we're not actually doing anything, are they really getting better? So that's where my behavior as a coach, as a professional, impacts what they're doing as a learner, as a developing person. Like off task, just not engaging in anything, waiting would be a big one. Like how do we manage our behavior to make sure that they're spending most of their time in this compliment? You know, I think that when you're talking about what they're doing, kind of breaking it. I think in the end, we directly influence what they do. Like our behavior, everything that we do is going to impact the athlete. So if we are moving, we're providing good feedback, we're providing good instruction, and we're moving around and they feel like those are being coached and they are being coached or worked with in any setting, you know, that's going to influence directly their behavior. If we're not doing that, we're not providing feedback, we're not providing positive instruction, that's going to impact their behavior. So what we do is in perfect alignment if they're going to get better. Now, that doesn't mean they're going to be successful on the field when it comes game time, but they've got to be improving if we're providing that. Thoughts? Anything else? So this was a little bit more formal, but what kind of had to envision is like maybe once a week, you know, we could lift, do something during lunch, and then people bring some ideas, whatever. Maybe different people share. We got sports med, we got mental health, we got performance, we got applied performance, nutrition, whatever the topic may be. I mean, it may be current events. It may be technology. We're bringing technology from the sports med room in here. We're bringing technology from over here in. It may be a situation like it's occurring in college sports right now. It could be admin, it could be sports psych. Nothing is off the table. And we spend like 20 minutes just kind of going through, just brainstorming. And that's kind of what I had envisioned here. You guys have thoughts and think, just kind of keep going from there. But nothing's off the table. We'll just kind of think about it on Wednesdays about 12:30, 12:35. That sound awesome?
Fantastic.
Great.
Awesome. Thank you guys
Thank
so
you.
much for coming today.
Thanks, Cole.